Welcome, Dr. Daniella. I am so excited to talk to you about all things sleep. I know that you're super passionate about this topic, but before we go into that, can you tell us one thing that you did today to take care of you?
Oh, I love that question. So today when I woke up, the first thing that I did to take care of myself was I actually took some 5 deep breaths before grabbing my cell phone, before running out into the living room to feed breakfast to my children. I took 5 deep breaths, just kind of center myself for the day.
What a good start. Yeah, so good. That would change everything if we all started our days like that.
Absolutely.
And so simple, right?
hmm
Can you share a little bit about you and what it is that you do?
Yeah, absolutely. So I'm based in South Florida. I'm a clinical psychologist, and my specialty is in health psychology. But in particular, I practice behavioral sleep medicine. So what I do is I treat folks, from children to adults who have difficulties with insomnia or nightmares, or perhaps they have sleep apnea and they have a hard time using their CPAP machine. I even have patients who have hypersomnolence, so things like narcolepsy, and helping them manage, their wakeful periods. And that's really the bread and butter of what I do.
Yeah, amazing. And how many kids do you have?
I have 2 children.
Oh, how old are they?
Yeah, so my oldest is my 5-year-old. She's my beautiful daughter, and I have a 2-year-old son.
Oh, wow. You must be busy with work and kids and life. That's lovely.
Oh, absolutely. My hands are full.
So, why is sleep so important? It seems like at this point, there's so many books that are coming out about sleep, and it seems so obvious that it's really important. But can you tell us a little bit about why it is important to us?
Yeah, absolutely. So everything that happens in the nighttime has profound ripple effects for what happens in the daytime. So when we sleep, there's this physical health piece, right? We need time for energy conservation so we can feel recharged the next day, so that we can go about our tasks and not have to work as hard. There's also this piece about immunity, right? So when we don't sleep well, we can't fight off disease as well. And it also allows for, growth hormones to help our body's tissues grow and repair. So getting better from injuries or even children, helping them develop as they grow. But then there's this cognitive piece, which I think a lot of us, millennials might be feeling this around now, where we need sleep so that we can consolidate memories well, so that we can pay attention, so that we can regulate our emotions, recognize danger, and solve problems effectively. So it's huge, not only for our physical health, but also just for our judgment, our decision making, and our problem solving too.
Yeah, I definitely notice that all myself when I don't get enough sleep. My emotional regulation is not
Mhm.
where I'd like it to be.
Yeah, I hear you. And for parents especially, it can be so difficult. We're all learning how to manage our emotions as we manage our children's emotions. And if you throw poor sleep in the middle there, then it can throw the whole ecosystem, the whole family ecosystem off balance.
Yeah, absolutely. So it seems like nowadays everybody's tired or exhausted. It almost seems like that's the norm now. Why are so many people tired?
Right. So right now we have so many folks that need to be in the workforce, right, to maintain these like rising costs of healthcare and housing and even childcare costs. That's been a hot button issue around here. Um, and we're just having these outsized demands and expectations. Particularly for women who are more in the workforce, but also carrying the majority of the household tasks typically. And so you have this huge cognitive load of trying to manage, family life and work life. And it's difficult, to manage those burnout effects when you're burning the candle at both ends.
Yeah, yeah, that seems like the reality for so many of us.
Yeah,
So,
and I feel like sleep of all the health behaviors, right, is one of the only ones that's actually involuntary. So even though we do have this wellness culture where everyone is trying to prioritize exercise and eating well, and even, the mindfulness and meditation piece, we can tell ourselves, I'm going to do that at this time. And odds are, if we're motivated and the stars align, they happen. But with sleep, we can't say, I'm just gonna turn the switch off at 10, go to bed, get my 8 hours. Sleep doesn't work like that. It's a process that unfolds naturally. And sometimes the more we force it, the more it eludes us. So it's something that we really can't control. And right now, I think we're in a society where we're all desperately seeking control, because of the demands, again, that life has kind of put on us. So it's hard. It's hard to get the sleep that we need because of these demands, the stress of not sleeping, creating even more insomnia. And it can just get away from us very quickly.
Yeah, absolutely. So how, if we are busy in the realities of modern day life and we're parents, maybe even parents of babies and young children, how can we work to get better sleep? What can we
Mhm.
do?
Yeah, I think the first thing is a big reframe on how important sleep is and what it really does. Because I think, especially in, I think in American culture, we also see this is this, rest and sleep is not productive. If I'm taking a nap, then that's something I didn't get done that day, an errand I didn't run, and we see it as time lost instead of time gained. So I think the biggest thing is to reframe the way that we see sleep, because research shows that the more that we sleep well, we're able to be more productive at work. We're able to handle our tasks more effectively. We're able to manage them in a way that's more time efficient, and we have more energy. So we also get more things done. So ultimately, if productivity is actually, a societal or personal goal, sleep works towards that. So I feel like a big reframe is foundational there. But then also intentionality. We have to be so intentional if we're going to get good sleep, like with most health behaviors. But it is about setting ourselves up for success and then just not holding on too tightly to the hope that you're going to sleep well.
Yeah, because if you do that, then you cause all that anxiety and worry that ends up leading to not being able to fall asleep, right?
Exactly. Sleep is should be treated less like a chore and more like a relationship that you have. I've often heard sleep be described as a shy friend. And so it's someone that you want to invite and welcome, but not someone that you want to smother, because anyone who is smothered will withdraw. Anything that you chase will run away. And so with sleep, we want to be welcoming and we want to set up an environment and circumstances that will be, promoting it. But we want to hold on loosely and accept, we know where we are in our sleep journey, and it will unfold naturally.
It's a fine balance, isn't it?
Absolutely. Yeah. As much as behavioral sleep medicine is founded in science, and there absolutely is a science behind sleep and how it works, it is an art to getting it actually done.
So you mentioned their environment. How can we create an optimal environment in our evenings or in our bedrooms or even in our days that will help to promote easeful sleep?
And I love that question because we often overlook the environment. We start making these changes maybe to our diet and our exercise or our timing, but we don't look at the physical space. And our environment gives us so many cues. We want our bedroom to be a relaxing place, a place that doesn't trigger us to worry about things. So oftentimes I tell folks just, do a quick inventory check. Is there anything that could be stressful about your environment? Do you have your laptop facing the bed? Do you have like expense reports on the table? Is there something in the room that is just, that puts you at unease? And then let's fix that and make it more of a welcoming space. But then there are things like ambient temperature that are also very important. As we fall asleep, our body temperature needs to drop. And so we want to make sure that the temperature in the room or in the home is not too warm. We want it to be on the colder side. We also need there to be sufficient darkness because one of those processes that regulate our sleep is our circadian rhythm. And so that's very much dependent on our exposure to light and darkness. And so one of the best ways to set ourselves up for good sleep is making sure that we get sufficient sunlight early in the day to set our circadian clock in motion, but then also to allow for sufficient darkness in the evening. And this is a good question because right now we're in the throes of summer, and summer has a way of disrupting our circadian cycle because we have these long days and we have so much sunlight. And so what I'm hearing a lot of my patients say is that they're going to bed later because we have sunlight at 8 o'clock at night. We have children who are saying, it's not my bedtime, the sun is out, or if the sun is rising earlier, we have kids that are also waking up earlier with the sun. Um, and so we have these changes. And so in the summer, what I recommend is making sure that you're getting enough dim light and darkness in the evening hours. So even if the sun is out at 8 p.m., making sure you're closing your blinds, starting to shift from maybe these white fluorescent lights in the home to warmer, dimmer lights that actually help to foster melatonin production, and starting to set the stage for evening time inside.
Yeah, I definitely noticed that with my kids. We are living somewhere right now where it does change so much. Like in winter, it can be dark at 4:30, and then in summer it is bright until 9:30 at night. So it is
Mhm.
very confusing for them and for their bodies. And
It
it is a
is.
challenge to help to them to understand how they need to go to bed when it's light out. It's really tricky.
It is. And their own biology is working against the parent bedtime routine as well, right?
Yeah, yeah.
So it is an uphill battle.
It is. We've got blackout blinds that we use more so in summertime, and that does help because I do notice if it is light, they're unlikely to fall asleep, whereas when the room is dark, they'll fall asleep so quickly, but if it's light, they want a story or another one or their back to be rubbed. There's a few steps because their bodies just aren't getting those cues that it is sleep time so quickly.
Yeah, absolutely. And I love that you mentioned blackout blinds because that is so important. The recommendation is actually that your bedroom should be so dark at night that you cannot see your hands in front of you, because it'll help your sleep feel more restorative. And then also sometimes folks wake up in the middle of the night, maybe around 3 a.m., and they don't know why they're awake. And it may be that they're shifting through different sleep stages. And in that stage one of sleep, where it's pretty superficial and we're very easily roused, sometimes light pollution from outside or noises, these kinds of things can kind of quickly rouse us from sleep. And so if you have those blackout curtains, even if you live in a place that's maybe urban or has more of this light pollution, you're protecting yourself from possible sleep disruptors in the middle of the night.
Yeah, that makes so much sense, and I experienced that myself. What do you think about those orange and red lights in the evenings or to have as night lights in the bathroom, let's say when you wake up and your kids have to go to the bathroom in the middle of the night, and instead of turning on a bright light, you have a little red light. Is this something that you recommend, or do you find that it is unnecessary to use this type of lighting?
No, actually, that is a good recommendation. So when looking at what color light is best for sleep, hues of red, orange, and yellow are actually better for preparing the mind and body for sleep. They are much closer to, what we experience at sunlight or candlelight. Warm light is similar to the setting of a sun, and so it can help signal that it's time for sleep. And exposure to bright lights and cool toned colors, which is why I kind of discouraged those, bright like fluorescent lights. That exposure to the cool tone lights and even blue light, from screens, from things we can get from phones, computers, tablets, and all of that, they actually inhibit melatonin production, and can keep a person awake. So I'm very much a fan of the warm toned colors.
Yeah, okay. If we think about motherhood or being a parent in general, during those early months postpartum, generally sleep is a big thing. People will pay so much money and consult so many different sleep training therapists because people are just desperate to get sleep themselves. What do you recommend that parents can do in those early months for their own sleep? They may not be able to get huge amounts, but what can they do to get just a little bit more or maybe better quality sleep at this time where sleep deprivation is just so pervasive?
Yes. Oh, and I'm also glad that you mentioned this because this goes back even to our first question of why are we so tired? And I think mothers and young parents in general, they hear this message, as soon as your kid is born, you'll never sleep again. Oh, prepare for the sleepless nights. Like we hear that all the time. And it is good to warn mothers of like pitfalls and things that could happen. However, sometimes these kinds of comments also set us up to be resigned to poor sleep. And so one of the things that I'm very passionate about is helping these young parents, these folks that are in the throes of momsomnia, as I like to call it, reclaim their sleep and feel like there is better sleep out there. And so as far as recommendations go, a reframe is also necessary, right? We need to reframe. And the first thing is that the problem is not necessarily sleep deprivation, but it's actually circadian disruption. So with young parents, when we say that, right, we always say I'm sleep deprived, but the issue is that we're awake when we should be asleep, maybe doing nighttime feedings or maybe, baby with a colic or just waking up, as newborns ought to do. And so we're awake at night and then we're asleep during the day, because we're regulating our circadian cycle to baby circadian cycle. And so we might be trying to sleep when they sleep, although I hardly know folks who do that. Um, and just feeling and being at home a lot in those first couple months. So I don't know if you've ever heard this recommendation, but I hear mothers, in that first month when the baby's born, they recommend that mothers stay in the home just so the baby isn't exposed, to certain, bacterias or flus or colds out there. And so moms generally stay home because they're also in their own recovery period. And this leads to some of that circadian disruption. When we're at home, we're exposed to this artificial light, and that's nothing compared to daylight. Where maybe the lights in our home are like 50 lux, the sun, is like 10,000 lux at least, and so we're not getting the same potency of sunlight. And so new mothers are really living almost like cave dwellers, just to put it into perspective. And so it's hard for us to realign our circadian rhythm and to realign babies if the baby's also living in those same conditions. And so some concrete actionable steps for mom is to make sure that whenever you want the first awakening to be, for babies, there might be, depending on the developmental stage, sometimes there's like a 5 a.m. wake up and then a second 7 a.m. one, it varies across development. But having maybe that one that's around 7, the most robust one, having exposure to sunlight for both mom and baby. So that can look like feeding by a window, opening up a window, even stepping outside, introducing early morning stroller walks, to get that direct sunlight as well. And also using your village if you have one. And so I know that this may not be as accessible to everybody, but if you do have either a partner or a family member, supportive grandparents, whoever it is, to help with shifts. Because instead of being on call all night for your baby's concerns, whether it's feeding or colic or fuss, knowing that you're, let's say, on the clock from, midnight to 4, but then your partner is on from 4 to 8 or whatever schedule you want to have set up can help, because in the middle of the night, you're always on edge. You hear every grunt and snort and every little noise your baby's making. And so that's how insomnia is created, with repetition of that on edge feeling. But giving yourself a shift can help you to go from being that on edge, having that on edge feeling, to saying, okay, so and so has it. And that can help you sleep deeply.
Yeah, because on being on edge and being alert, that's the opposite of relaxing and getting into that parasympathetic nervous system that you need for sleep. You're on alert, which means you're awake, right? So that's just so counterproductive, isn't it?
Exactly. You're waiting for it. You're waiting for the other shoe to drop. So you've got this anxiety, you've got this hypervigilance. And then even if you do drift off into sleep, you're almost listening for all the noises. And so you're in that stage 1. Um, And what also happens, which is funny, your body tries to help you, is that you can have something called REM rebound. And so if you have a long period of time where you're getting this superficial sleep, your body tries to help you so that the next time you fall asleep, you go into REM first, so you can get some of that deep sleep. And so you have a lot of new moms that are spending a lot of time in REM. And REM also happens to be the time where you do most of your dreaming. 95% of your dreaming happens in REM. But if you're anxious and you're, in that fourth trimester and you're having a lot of dreams, what I also see often is you've got a lot of new moms with a lot of nightmares, and then that's interrupting your sleep. And so taking care of any latent anxiety, any stress, taking care of the whole self is foundational for sleep too.
So there's a lot that we can do in the evening and during the night to support ourselves to have better sleep, even if we have a newborn. But it sounds like there's a lot that we can do throughout the day. And even as we're pregnant, working on things like what we're anxious about and finding coping strategies. There's so much
Mhm.
that we can do ahead of time, isn't there, to help support us through that time that sleep can be a little bit trickier.
Yeah, and getting the help before you need the help. I know that folks often seek out, mental health providers once a problem has been established. But I feel like it would be good practice, for anyone who's expecting, whether it's a biological child or you're adopting, if you're in that process, speak to a mental health provider, see what coping skills you can build, and see it as like a self-improvement project before it gets to the point where your sleep is so bad that now it's a chronic condition, or where your anxiety is so bad that now it's a chronic condition.
Yeah, it would be amazing if we did this not just with sleep and anxiety, but with all aspects of our health and well-being. Because if we can address things proactively, or when something is noticeable but not a big issue yet, there's so much you can do there. And it's so much easier to work with that than when it has become a full-blown issue. So I
Mhm.
think in general, if we can work with mental health and our wellness to be a proactive thing rather than when we really, really need it and we're in a dark place, it would change so much for ourselves, for our families, for the whole world, wouldn't it?
Exactly. Yeah, a preventative approach is always better from
Yeah.
a public health perspective, at least.
Yeah, generally, those humans, we don't do things until we really need to, though, right?
Exactly.
So, what about napping? Because you were saying that those early stages of like that fourth trimester, those early stages of being a mother can shift our circadian rhythms and mess with them. And we may end up sleeping more in the day or feeling like we're in that cave. So we're confused about night and day. Is napping a good idea then? Or should we be focusing on getting the sleep when we're supposed to, when it's dark outside? What do you recommend there when it comes to napping, especially for those early months?
Yeah, so that is an excellent question. Because I'll say this, if you were to ask any sleep specialist if napping is good for nighttime sleep, they may give you this robust answer of no, it is not. However, I would say that the only exception that I really give, or I guess there's two exceptions to napping, is for those newborn mothers. The mother's not, sorry, in the newborn phase. I suppose they are newborn mothers. And also for folks who need a nap in order to, drive safely and all of that. So to give you some more background, there are two processes that regulate our sleep. There's that circadian rhythm, which we've discussed so far, but then there's also something that's called your homeostatic sleep drive. So that's just a really fancy way of saying your sleep hunger. And so during the day, your sleep hunger accumulates, so our appetite grows and grows and grows. And eventually at night, our appetite for sleep is so large that we fall asleep. Right. And then as we sleep, that drive falls again because it's like we're feeding it. We're feeding it with our slumber. And so it's low at the beginning of the day when ideally you've had a good night's rest, and it's really high at the end of the day when you're tired and sleepy and it's time to go to recharge. If we take naps in the middle of the day, it's a little bit like snacking. That nap is going to lower that sleep drive and then make it harder for you to fall asleep at night. And so Typically, in most cases, we say, don't take a nap because it'll take away from your nighttime sleep if you have insomnia. Some folks can take naps and it doesn't impact their nighttime sleep, and that's excellent for those folks. Don't change a thing if your sleep is fine. But for newborn mothers, we're in a very specific situation where our circadian rhythm is totally disrupted. There is sleep loss, and we do need sleep in order to care for our child effectively and for, our own cognitive function, right? So sleeping is allowed in that newborn period. What we recommend, just to make to optimize it, is to make your nap align with the baby's most common nap. So initially, we get this fragmented sleep. The periods of wakefulness are small. The periods of sleeping during the day are small. But eventually, somewhere around, those like 8 weeks, there tends to be like this mid-morning nap that can form and also this afternoon nap. And so every child is different, but planning your nap around the baby's most robust one, the most common, like one that you can count on, predict, will definitely happen, and trying to align it in that way. We also recommend that naps not be longer than 30 minutes. And the reason for that is because, a sleep cycle, going through the 4 stages of sleep takes about 90. And if you reach that deeper sleep in the middle of the day, it can make you feel a little groggy and unrefreshed for the rest of the day. And so we want to try to get those 30 minutes where you get a little bit of juice and then you can keep going without then feeling groggy, the rest of the day. And so for folks who perhaps also need to nap in order to drive safely, we also say take a 30-minute safety nap, and then, keep it moving. But napping is definitely okay, in that newborn phase. The second recommendation is also not to just nap too late in the day. If you're napping around 5 or 6 p.m., that could start to take away from your nighttime sleep.
Yeah, that all makes perfect sense. And I think we've all experienced that groggy feeling, and it can take hours sometimes to get out of that. Those naps
Yeah.
make you never want to nap again, right?
It can be disorienting.
Yeah, that's a good word for it. So when it comes to sleep, what are some things that we can do with nutrition and with our diet and even with our lifestyle? We've talked about some lifestyle things we can do, but what else can we do to support optimal sleep through lifestyle and food or supplements?
Yeah, that's a great question. So for lifestyle, regular exercise, as it's good for our hearts and our muscles, it's also really good for our sleep because exercise is one of those things that helps regulate our circadian rhythm. So a lot of what we do in sleep medicine is try to build predictability in our schedules, so that we can have this automaticity at night. I'm sure there are some things that for you may feel automatic, like maybe you wake up, you brush your teeth, you make breakfast, and you don't even have to think about it. And we want our sleep to be the same way. And exercise is one of those things that you can put into your day that helps to regulate your circadian rhythm. So definitely exercise is one of those things. And then when it comes to, a diet, if you're eating well for a healthy heart, for diabetes management, for weight management, if you're eating well, a lot of the same things that you're doing will actually carry over into sleep promotion. So we've found that, foods like whole grains, avocados, bananas, nuts, seeds, beans, like these things are good sleep promoting foods. Anything with antioxidants and polyphenols. So, berries, also lean proteins and fish. These kinds of foods help to promote good sleep. And you'll notice that these are also foods that we just generally promote for good health overall. So if there is someone out there who wants to eat for better sleep, the good news is that if you're eating well in general, you probably don't have to change anything too radically. There are some foods to avoid at night that can also disrupt sleep, like foods that are perhaps spicy or high in fat or fried. These things can provoke acid reflux, which can be disruptive towards sleep. But of course, it's person specific. If you've been eating spicy food your entire life and it doesn't impact your stomach, then you don't have to make changes. But generally, acidic things, spicy foods, those things can disrupt sleep. Alcohol. Alcohol is a big one. So sometimes folks, and I hear this a lot actually in the clinic, they drink alcohol because they think it makes them fall asleep. And alcohol does have that initial soporific effect where you do get a little drowsy, but it is a false friend because it will impede your ability to get into REM sleep, which is some of that deep sleep we need to feel good. And it also creates fragmented sleep. So even if you fall asleep initially, it's going to wake you up a ton during the night. And the same goes for nicotine and caffeine. Caffeine is a controversial subject because some people can drink espresso and go to bed, and bless them if they can do it. But there is variability in how we metabolize caffeine. And it can stay in your body for 2 to 12 hours, depending on how you metabolize it. So caffeine is one of those things that can not only impede your ability to fall asleep, but also impede your ability to stay asleep.
So with caffeine, do you recommend that people check in with themselves and how they metabolize it and how they notice their energy levels? And then once they've done that, is it something that generally we should be having just in the morning? Or do you recommend if you're having trouble sleeping that you just get rid of it completely? Where do you stand on that?
Yeah, if you're having like chronic insomnia issues, then my recommendation is to curb caffeine 12 hours before your intended bedtime. So if I want to be in bed, let's say at 10 p.m., I'm not going to have coffee after 10 a.m. If I know myself and I'm having, chronic sleep issues. I personally am sensitive to caffeine, so I know that about myself. But there are folks like, let's say my husband, he can have espresso at night and go to sleep and he sleeps great. And so I wouldn't make the same recommendation for him. But if you are having sleep trouble, I would try to eliminate some of it. You can start curbing. You don't have to drop all 5 cups, maybe drop 3 or drop 2 and work your way down. Find alternatives that are caffeine free. Like if you really like having a warm beverage in the afternoon with maybe a little snack, and if that's part of your culture, maybe getting, some decaf coffee or, an herbal tea. You're trying something with a little less caffeine because teas, of course, also have caffeine depending which one you drink. So I would start with tapering if sleep has become an issue.
Yeah. And in terms of exercise and eating, for both of those, when do you recommend doing so? Like with exercise, I have heard that exercising late at night can make you more alert and cause you to have trouble falling asleep. And then there's different ideas about eating, when you should eat, so you can not be digesting, and then you can have that energy for resting and falling asleep. Where do you stand on both exercise and eating in the evening, and what are the best times?
Right. So with exercise, we don't want to be doing anything too intense within 3 to 4 hours of your bedtime, which I know may upset some folks because if you're working a 9 to 5 job and you have a hard time waking up in the morning, when else are you going to exercise? So I would, figure out a schedule that works for you. See if there are days where you can prioritize exercising a little bit earlier if you're that person I just described. Depending if you're working out 4 days a week, maybe choosing the weekends so that you can work out earlier, and then you only have 2 days a week where it's closer to bedtime, but trying to move it a little bit earlier, especially if it's intense, like if you're doing a high intensity interval class or something that's elevating that heart rate. Because remember, as I mentioned, we want our body temperature to be falling in the evening to help promote that sleep. And the same actually goes for dinner. The recommendation is generally eat dinner, 2 to 3 hours before bed. You don't want to be eating dinner and then jumping into bed, just to give yourself a chance to digest. And if you are eating closer to bedtime, make sure you're not eating something too heavy. So I often tell, my insomnia patients, don't eat like a juicy steak right before bed because your body's gonna have to work really hard to digest that. And there's nothing wrong with eating meat. In fact, meat has a lot of vitamins that could promote good sleep. But if you want to have it a little bit earlier in the day or have it for lunch. Just make some modifications in that way. Try to eat lighter in the evening. Try to keep it 2 or 3 hours before bed. With a caveat, if you're someone who has low blood sugar, then I do recommend having maybe a late night snack, something to tide you over, because otherwise you may have an early morning awakening because of that low blood sugar dropping. So having, like a complex carb with a protein, nothing too heavy, something like apples with peanut butter or a Greek yogurt, just something, to hold you over, but that isn't, overpowering.
Yeah, okay, that makes a lot of sense. As a sleep psychologist, what do you recommend doing for kids? Like, how do you support your kids to be amazing little sleepers?
Yeah, so routine is everything, and starting a routine as early as possible. And so much of what we do with adults also translates into children. We want to build that predictability, and we want to make sleep inviting and fun. We don't want our kids to feel like bedtime is punishment. It's like, oh, I have to be put away now. We don't want to foment those feelings. So coming up with a bedtime routine that is fun for them is important, and also a bedtime routine that has a natural progression to the bedroom. So sometimes we get those bedtime struggles where it's like, no, I don't want to brush my teeth. No, I don't want to do this. I don't want to do that. And it can drag, and then parent emotion management gets tough. But creating a bedtime routine that naturally moves in that direction. So for example, instead of okay, let's do a bedtime story in pajamas, then brush our teeth, and then come back to bed. We start outside of the bedroom and make our way closer to the bedroom as bedtime nears, right? So we want to start our routine outside, brushing teeth, bath, whatever is in your lineup, and then moving into the bedroom, having, your bedtime story, your cuddles, your prayer time, your chat time, all of that for last, so that there's no back and forth, because back and forth can create distractions, and then that can create resistance, and then that can create conflict.
Yeah.
Yeah, so that helps build predictability, because then they know it's like, okay, I brush my teeth, we read a story, we go to bed, and creating that automaticity, that predictability can help. And even visualizing it, especially for the younger kids, for toddlers, having a chart, the bedtime chart is so helpful, because then they can also feel like they're achieving things. So if you have, and this is what I did with my kiddos, I had pictures, like pictures of actual children, not cartoons, brushing their teeth, putting a pajama on, reading a story, and being in bed. And every time that they did one of those, they put a sticker, and it was like, okay, I did that. Oh, I got this one done. And then they did the next one. Oh, I put a sticker. I got that one done. And so there's this naturally reinforcing way of getting the bedtime routine in.
Yeah, that makes it a lot of fun then and engaging for them. And they probably feel like they have, over time, more autonomy in that because they're not just being told what to do. They can look at the chart and say, I know what I need to do next if they forget.
Right. And giving them autonomy to choose a piece of their bedtime routine too. Because then that makes it even more fun, because it's like, oh, I get to choose the bedtime story, or maybe I want a dance party before bed. And that's my choice. We do, and maybe we work that in somewhere. But giving them the autonomy to choose something about their bedtime routine can help them feel also less resistant, because it's like, I'm a collaborator. I'm not just being told to do something, and they'll naturally look forward to it.
I like that you mentioned the dance party because there's some nights where we slowly progress into calmer and calmer and darker rooms and activities as the night goes on. But sometimes my kids do need to wrestle or they need to jump around or do some somersaults. Or before we go into bed, go and jump on the trampoline just to release some of that extra energy. So it can vary depending on the child and even depending on like what happened that day, what the kids ate that day. So that calmness is ideal, but there are those moments where the dance party is really essential.
Oh yeah, we got to get the wiggles out. And it also varies depending on which parent is doing bedtime routine. I don't know about you, but I tend to see a trend of really rambunctious fathers. And I see a lot of memes about that. It's like, oh, me trying to get my kids to sleep, and then dad comes in and flips them around. And, that is necessary too.
Yeah, yeah, that can be actually super helpful. Sometimes not, but a lot of the time, yeah.
Yeah, we'll use our judgment on that one.
Yeah. What do you recommend in terms of like books or resources outside of your resources on sleep and just sleep in general, but also maybe even sleep when it comes to parenting or kids? Are there any podcasts or books or I don't know, any other resources that you recommend?
Yes, there are a few. So for parents, so for women in particular, there is one book, um, A Woman's Guide to Sleep, and that one can be really helpful. That one is by Dr. Shelby Harris. There are many pediatric books out there by Jody Mindell. I believe it's let me see, A Guide to Pediatric Sleep. I'm gonna have to give you the exact title so you can put that as a resource for folks. But I also find what's really helpful is, and I do this, and this is helpful for kids. There's a book called Mr. Pout Pout Fish and the Sleepy Time Blues. And I know that this perhaps is not the resource you were looking for, but in this book, Mr. Pout Pout Fish cannot fall asleep, and he asks for help from all his friends. And all his friends tell them what they do to set up their bedtime routine and what helps them sleep. And it can actually facilitate a really helpful conversation between child and parent on how they want their bedtime routine to go. And you just create relatability for kids and parents. So I always recommend that one as something to work into your own bedtime routine because it's such a fun book for talking about sleep to kids. Um, yes, but and I love that you mentioned books. I have a few projects in the works as well, and so I'll be keeping you posted as I get more information about that. But A Woman's Guide to Sleep is a great place to start. And A Guide to Pediatric Sleep by Jody Mindell is another great resource.
I'm gonna have to check those out. And I loved that kids book recommendation. That sounds amazing. Probably helpful for adults too, right? To just be reminded, oh yes, I need a sleep routine because we get our kids into these routines and sometimes they can be simple, sometimes they can be very extravagant, but often parents then might go and just watch TV and then think, okay, now I can fall asleep. But they
Mhm.
need that progression as well, just like our kids do. So a book could be a good reminder for everybody.
Absolutely. And as far as podcasts, Dr. Shelby Harris has one called Sleep Talking, and that one is a lot of fun. And it covers a lot of relatable topics. And then for those of you who are more into like the science of sleep and maybe want to know more on that end, I recommend Sleep Junkies.
And that's a podcast.
Yes. And so that one is, a little bit more for those who want some background on how sleep works, and it's still fun to listen to, but it definitely has more of a scientific slant to it too.
Amazing. Thank you. And I am excited to find out what's happening for you with books in the future.
Yes, I will definitely keep you posted.
So before we wrap up, I just have a couple questions. What do you do to support your children's emotional development?
So I actually used to provide emotional behavioral therapy for kids. And so the number one thing that I do with my kids is help them label their emotions. We can't work on a feeling unless we know what it is. So I did that with my kids really early on. We do that with puppets. We do that with we have these really great Love Every like wooden puppets that also help you feel a texture that might equate with an emotion. Like sadness is a little hollowed out. Frustration has like these ridges on it. And so finding ways to identify with an emotion in different ways, different sensory ways, being able to label it, seeing it in yourself, having them look in a mirror, make an angry face, make a sad face, make a happy face. Because if they can identify it, period, end of story, or even identify it in themselves, then they can also start to identify it in other people. And then we can start to create a generation of little empathic learners. How do you think that made so and so feel when that happened? Oh no, are they sad? Should we check on them? Those kinds of things. So that's what I do to foster some emotional regulation in my kids.
That's amazing. And just think about how further ahead your kids are going to be on that because a lot of people aren't taught that. A lot of people, particularly of our generation, probably weren't taught that. So if they're starting at a young age, they're just going to be set up so well.
Yeah, absolutely. Sometimes I do feel like I'm learning along with them. Like, that's a great way to do that.
But that's parenting, right? It's a self-development journey if we allow it to be that.
Yes, I love that. As parents, sometimes I think we like to think we have it figured out, but we really are works in progress. And being open to that change and being open to saying, oh, I didn't know that before, or I could do this differently is so important.
Yeah, exactly. And that's good teaching for our kids too, to have them know that we don't have everything figured out and we can make mistakes, and that's okay because that allows them to be imperfect and make mistakes as well.
Exactly. And mistakes are okay.
Yeah. What about how you support your kids to be lifelong veggie lovers or just generally lovers of whole real foods? What do you do?
Oh yeah, I was a big fan of intuitive eating for my kids, and so I provide the healthy foods. I expose them to it. I definitely don't try to force my kids to eat anything, and I do think that's also a generational thing where maybe we grew up with you need to finish your plate or this is what's for dinner and you have it or you don't, and so. I'm a big fan of putting it in front of them. Eventually, they'll become curious about it. I like to recommend, try it once. If you like it, you like it. If you don't, you don't, and we move on. But providing a lot of variety and not making it feel forced, just so that they can learn from their own cues, because we all have foods that we may or like or not like, maybe I'm not a big fan of radishes. That doesn't mean I'm not going to be a healthy eater. That just means maybe I go for asparagus instead. So providing foods that even I don't like has also been a big one because I think that we only buy things that we like, right? Like, so buying things that maybe I'm not a big fan of, but getting my kids to be exposed to them, so I can give them a chance. Like, for example, I'm not a big raw pepper eater. I prefer to have my hummus with pita chips. Okay. But my daughter loves raw peppers. So I like slice them up into little strips for her and she eats them. And if I hadn't done that with her, she would have never picked up that habit. So being open to bringing in new foods, even foods that you don't like into the home, I think is important too.
Those are great tips. Yeah, for sure. So tell us a little bit more about your work and how people can work with you and what resources you have available.
Great. So I have my website, daniellamarchetti.com. And on that website, I list all my services. So I provide teletherapy. There's also opportunities there for speaking engagements and seminars and things like that for anyone who wants more of like an educational resource. I also provide some testing in the Florida area, so that's available to folks. And people can schedule a consultation with me there. Folks are also welcome to come to my Instagram page at Dr. Daniella Marchetti. I'm always posting, just some, actionable things that people can do for their sleep. It's a place for me just to kind of put any health tips out there that I think are important or interesting. Um, and yeah, that's how they can find me. Right now, I'm serving the Florida, anyone who's based in Florida. But I will be SciPact certified soon, and then I can reach folks across 42 states. And so I'll keep everyone tuned on when that happens because I would love to be able to extend my reach too.
Yeah, that would be amazing. And your Instagram, I must say, is just so useful. It's so clearly put together, and every single post you have teaches about something to do with sleep and how to make it better and what we need to reframe and on and on. I highly recommend people go and check it out.
Thank you. Yeah, education is one of my passions. So any opportunity to talk about sleep, I'm here for it.
Amazing. Was there anything that you wanted to talk about or you wanted me to ask that I didn't ask here?
That's a good question. I think that we covered a lot of good topics today. Yeah, there wasn't any one thing that I think is missing. Um, if anything, we didn't dive into supplementation too much. But Those are good ways. Those are like insurance policies, is what I always say. So supplements are wonderful, but they are insurance policies. We want to make sure we're promoting good sleep through our habits and the way that we think. And we can promote it with, magnesium and L-theanine and valerian root and all these wonderful things. But if you want to change your sleep, then it's important to make these behavioral changes. And if you feel like you need extra help, if you're not able to do the sleep hygiene on your own, if your sleep persists for more than a few weeks, then speak up and see a professional, whoever it may be, in whatever area you are, because insomnia can be diagnosed in 3 months. But folks that I see have usually had insomnia for years, if not decades. So let's get assessed early. Let's get treated early because better sleep is out there. And it's just up to us to reclaim it.
Amazing. Well, thank you so much for coming on today and sharing so much knowledge and wisdom. I really appreciate it.
No, thank you for having me. This has been such a pleasure. It's been really great talking to you.